absolutely fantastic, amazing program. It really saves a lot of time in my practice. I use it for my operative reports. I generate them in 5 seconds, and I can customize them any any scenario. My name is Dr. Michael Albin. I'm a general surgeon. We're private practice, so we run our own practice, and we're essentially in charge of everything. And I'm in charge of the IT aspect of my practice. We're in Pasadena, California. There was really no good solution when it comes to EMR for individual practices, small groups. Most EMRs are made for either primary care doctors or they're made for big hospital institutions. So there's none that's really efficient and specific to surgeons. For instance, if I was generating a template, say it could be an operative report, the way I had to do it before was to look at my prior operative reports, and I had to restructure it every single time. So there's no customization. You essentially had to find the similar report and then re-edit it based on that. And the problem with that is that if you didn't edit correctly, then you're more likely to generate an error. One thing that is an issue that you have whenever you use any sort of templated software is that if anyone is reviewing it, they tend to feel that your documents are what they call boilerplate or templated. And they could tell that you're essentially not really putting enough individual customization or attention to the document. Well, PhraseExpander allows for so much customization that you could really individualize your documents. So it's, even though essentially PhraseExpander allows for you to expand and has some templated aspect to it, the documents are not templated. They're all individualized. And because they're all individualized, it's key and critical to medical practice because it essentially allows you to individualize for every single patient. And so it's an amazing solution, probably the best out there. By using PhraseExpander, I increase the efficiency in my practice. So I now have more time allocation for other activities. So if anything, it's not so much of a time sacrifice, it's more of a time gain. And by having more time to do other things in my practice, I could run it better, I could run it more smoothly, I could spend it on giving more time on giving quality patient care. And that's what it's about, is giving good patient care and not about documentation, which is unfortunately what most physicians have to deal with nowadays. Is they're so bogged in documentation, you lose a lot of the patient care aspects. I would say what would normally take around 5 minutes, say 5 minutes of documentation per patient, takes a few seconds, so that's like a 4-minute stave. It really depends on my days. If I have very busy clinic days, I could have up to 40 patients in a day. So it's saving hours. No, of course, hands down. I mean, I think whether you use PhraseExpander individually just for Word documents or templates, or you use it as an addition to your EMR solution, it will increase the amount of time you have to do other things in your practice. It'll increase your efficiency in your practice, and it reduces a lot of the stress that electronic medical documentation creates. So hands down, I recommend it to any practice. It's well worth it.